Good morning, good afternoon, and good evening to everyone from around the world. I'd like to thank you for taking time out of your busy lives to partake in my workshop. I hope you find it enlightening and elucidating. Let's begin. Today we're going to talk about matters of the heart, treating anxiety and trauma and other emotional type of issues with heart rate variability and audio-visual entrainment. What we're going to be talking about today are psychological factors that affect heart rate variability, plus a novel technique for dramatically enhancing results in heart rate variability training. We're going to learn about the physiological and psychological inputs into heart and breath functioning. What is very interesting about heart rate variability, in my opinion, is that it works best, at least at the onset, as a diagnostic tool for overly activated autonomic nervous systems, which are typically tied to lifestyle and stress issues and what's going on in people's lives and so on. We're going to learn about how to use the Spectrum Audio-Visual Entrainment Eyeset, or AVE Eyeset, and how it's used with the Breathe app that you can download into a personal computer for Windows 10, and it's free on the internet, and you can actually download it and have the Breathe set up as a pacer on your computer to remind you when to breathe while you're working on your computer. So, emotional inputs into heart rate variability and heart rate in general. This is a moment here that I was particularly excited over. I'm not very used to catching seafood. Catching this crab certainly had me very excited. I'm sure my heart was racing at a very high pace, and there was probably not much variability at that moment. Now, let's talk about a couple things, how heart rate variability works and how emotional inputs affect it. Well, here's basically how heart rate variability in itself works, assuming there are no emotional or cognitive inputs into the brain's regulation of our heart as we breathe in and out, so with our respiration. The carotid sinus baroreceptors are innervated by a branch of the glossopharyngeal nerve, which is the ninth nerve. The glossopharyngeal nerve synapses in the nucleus tractus solidaris, RTS, which is located in the medulla of the brainstem. So this is very low-level functioning, and it needs to be, of course, because in the case of brain injuries and so on, you don't want to lose heart function. You want to try to stay alive, and being in the brainstem is very robust. It's quite immune to concussions and so on. The aortic arch has baroreceptors in it, and they're very, very sensitive to blood pressure and so on. And we can see here that there's two parts to it. There's the sympathetic part, and there's also the parasympathetic part, which is the vagal nerve. And they all root up into the brainstem area, the medulla, to allow autonomic control of the heart and blood vessels. Now, of course, heart rate, blood pressure, and so on is very critical for survival. So when you look at these curves of baroreceptor sensitivity, you can see just how linear they are, particularly in the 85 to 100 millimeters of mercury range, which is, of course, where our hearts typically are operating in that range, although they often are up to 120 or so. But we can see that they are extremely linear, and that is, of course, required for very, very accurate control of our blood pressure and so on. Now, here's a good example of how the sympathetic and parasympathetic or vagal activity regulates our heart, assuming there are no inputs from the autonomic nervous system. So we have cardiac output, which we'll call CO, and systemic vascular resistance, SVR. They're balanced to maintain proper arterial pressure. So when we inhale, there will be a drop in arterial pressure. The baroreceptors will pick that up. They will activate sympathetic neurons and speed up our heart rate. So on inspiration, with the falling pressure, we get sympathetically activated. The heart rate speeds up as we inhale. And then as we exhale, the pressure builds, and vagal activity, which is parasympathetic, activates to slow our heart rate down. And this is how heart rate variability works. So aside from emotional inputs into dysregulation of heart rate variability, what happens if you were to push yourself extremely hard physically and have physiological inputs into dysfunctional heart rate variability, or maybe I should say restricted heart rate variability? So the question is, what happens when you really jack up your cortisol, develop rhabdomyolysis, which is muscle protein loss, and adrenal fatigue? Let's take a look. This was last year, and 2019, May. This is a glacier we climbed over, and then we camped out on the right-hand side of that glacier, 16 kilometers back. It was a 650-meter climb with 40 pounds or about 18 kilograms of weight on our backs. I was using backcountry skis, and I really should have had alpine touring skis. And so my skis were really giving me all kinds of issues. They were very hard on my legs because they were always bending and contouring with the snow that had melted a great deal more than we had expected. So it wasn't a very flat surface. So anyway, here we go. We start this venture. It got quite warm. There's a little something I can point out to you. Our ski poles have daggers in them, so if someone falls into a crevice, we fall down on the ground and we dig that dagger into the snow to stop that person from sliding into the crevice, and us along with them, of course, and that's called a whippet. Here you go. At one point, you can see there was an avalanche happening behind me. It's just part of the excitement. What can I say? I love this stuff. This is near the top here. There was a large crevice that was snow bridged. And we fortunately made our way over that without any issues. And this here is camping out on the glacier. And here we go. However, when we got there, as we were getting there, and I was getting quite stressed physically, I noticed I was starting to have brown pee, which represents protein loss. By the time we got here at 16 kilometers, my other two mountaineering friends wanted to go 18 kilometers, but at 16, I had to stop. I was dying, and my pee was seriously brown. My heart was racing terribly. That night, I did heart rate variability breathing, which I'm fairly good at, trying to get my heart rate down. I was timing it, and it was about 80 beats per minute, and it was very, very flat at 80. It was not speeding up or slowing down during respiration at all. And that was a concern to me also. And I tried for half an hour to get my heart rate to slow down or get some variability in it, and it was not responding. It was entirely locked in to an autonomic nervous system that was in overdrive as it was trying to save me from severe protein loss and liver and kidney issues, which also are of great concern when you develop rhabdomyolysis. So here's a little study showing just that. What we're looking at here are people who died or survived following hydrocortisone injections. Now look at the left panel, the left picture here. The big yellow red arrow, that's where I was that night after I'd severely stressed my body and my organs, and I had no heart rate variability, and that's a bad place to be. Now, when you're looking at adrenal insufficiency, that is also tied to lockdown heart rate variability, as we see in the darker graph. People without adrenal insufficiency have a wider swing generally in heart rate variability. So the study that was done by Morris, they looked at two groups here. Now, here's the group that lived in black. Here's the group that died. This was their heart rate variability prior to hydrocortisone injections. When they gave them the injection, one group's heart rate variability sped up. The other group did not, and this was the group where people died. So heart rate variability is indeed an indicator of mortality, and very important to have. However, you can certainly clamp it down emotionally very, very quickly when there's a traumatic event that occurs. Still not healthy in the long term. So what about heart rate variability, behavior, and stress? It's important to understand just the level of which stress and the autonomic nervous system affect heart rate variability. And we're looking at HRV. Parasympathetic activity is reflected in faster frequencies. That'll increase. And sympathetic activity is reflected in the increase in slower frequencies. When it comes to HRV, we don't know if our client has psychological or physiological issues. These must be addressed carefully. It may not be a matter of just simply not breathing well. And typically, it's not a matter of just not breathing well. It's definitely usually psychological or physiological issues that are throwing the heart rate variability off in the first place. If it is deemed to be psychological, then counseling or cognitive behavioral therapy would be indicated. Well, it's good to be proficient in HRV breathing. HRV biofeedback is not the answer to psychological inputs. If you do so, you could make a person less reflective of therapy and feel better despite not having the issues addressed. So I always say never do HRV while there's therapy going on, because you could use it as a diagnostic so well, and you don't want to mask that ability. Stasis, which is the lack of endogenous variability in neurally mediated peripheral systems like heart rate, is a sign of severe physiological distress. So again, let's look for that, and let's deal with it appropriately. Now we're going to look at some exciting cases coming right up here, just showing how profound psychological inputs to heart rate variability are reflected in the heart, and why we need to address them without doing biofeedback right at the onset. Now, a little bit about entrainment. Entrainment produces an effect known as DAR, dissociation and restabilization. Entrainment dramatically improves HRV outcomes in highly anxious people. We use HRV all the time as a triage application just to get people stable so that then you can start to do therapy with them. You can't do therapy with someone who's all over the board and struggling with anxiety and having all kinds of issues. They're just too unstable often. A little bit about entrainment. I got involved in entrainment in 1984. I started developing my first device, and I had hair then. And these are a picture of some of the devices that I've made over the years. I've made quite a few, actually. And up in the upper corner here is the first brainwave synchronizer with the orange screen that was a neon light that they would flash. And so we're going to talk a little bit about entrainment. Now, of course, the concept of entrainment implies a frequency following response. So you put a frequency into something that's biological, in this case, into our senses, and the brain activity will follow that frequency. While this is true, frequency is the least of what entrainment does. Entrainment dissociates people in a meditative kind of way, and in the process of doing so, it breaks the HPA axis, the hypothalamic pituitary adrenal axis. It increases cerebral blood flow, and cerebral blood flow is shunted down during stress and anxiety. It also increases lactate, anaerobic ATP, adenosine triphosphate. One study showed that lactate increases were up to 260% in a 5-minute span during the application of entrainment, and that's very powerful. Low lactate levels are again associated with brain injuries and panic attacks and severe anxiety. Entrainment drives it up very well. It also balances neurotransmitters. A cerebral spinal fluid study by Shiley found that norepinephrine was pushed up 18%, but not 200 or 300% like you might see in a flight or fight response. And serotonin was driven up 23%, endorphins were 13%, all in a half an hour. Entrainment excites neurons and glia, and there's more and more research showing the importance of glia in neuronal functioning. It increases heat shock protein 70 quite significantly, and heat shock protein 70 acts as a protective barrier against bacteria and viruses, but it also has anti-inflammatory effects in the brain. A recent study came out showing that entrainment also affects specific cytokines in the brain that are frequency dependent. So we're going to be focusing on just more the hypnosis dissociative aspects of entrainment. If you want to see all the aspects of entrainment and how they play out on the brain, please see my first lecture, Physiology of Audio-Visual Entrainment. And we get into great detail and show all the research combining all those different effects of entrainment and how they play out on the brain. But meanwhile, this is a study done by Kroger and Schneider using the brainwave synchronizer, done in 1959. And we can see here that pretty much 80% of everyone was in a hypnotic trance, which is a form of dissociation. And they were there within 5 minutes. And this is why entrainment is so powerful, especially from a triage type of application, because you can take someone who's falling apart, in a sense, and calm them, settle them down rapidly, and get them grounded again, get them into homeostasis. Entrainment has proven itself over and over and over again to break the hypothalamic pituitary adrenal axis, or HPA axis. And it breaks, we're not entirely sure where it breaks the loop. Certainly on the cognitive side, it certainly breaks it. One of the things about stress and anxiety is as norepinephrine skyrockets and serotonin crashes, the brain gets extremely racy. And that racy condition of the brain will reinforce the anxiety and stress. So you need to break that axis at some point, and it does it very well, probably more on the cognitive side, but yeah, very effective. And here are a few examples of that. Now here what we're looking at is a person, of course, with very cold fingers who's vasoconstricted because of sympathetic overactivation. And we can see finger temperatures of 74, 75 degrees. Those are cold fingers. That's almost room temperature. You can see here at about the 6-minute mark, when a person is dissociating into DAR, dissociation and restabilization, finger temperature really starts to take off. When you're looking at skin conductance, of course, sweaty hands are associated with a heightened autonomic nervous system. And what we can see here, again, at about the 6-minute mark, as the person dissociates and restabilizes, dramatic dropping off of sweaty hands as they get drier. Here's a study also, or here's a case showing a golfer with forearm tension, and you cannot golf well if you have tense muscles in your arms. And we can see again at about the 5-minute mark, dramatic dropping off of muscle tension. So a lot of the sort of magic, if you want to call it that, of entrainment happens at about the 5-minute mark and continues on from there. Here's a study done on Metro-Dade police officers in Florida, and by Brucato and Abascal and Stevens. And what we can see here is that there were 5 police in the study that completed the study. The treatment was about 10 weeks, and there were 10 35-minute entrainment sessions. Now, each session used a variety of frequencies, which is a bit of an unusual approach. But in this case, it might actually exemplify the dissociative aspects of mixing up the frequencies. In this case, it'd be more dissociative than it would be entrainment, because entrainment, you need to keep your frequencies fixed to some degree, or to a greater degree anyway. Anyway, members of the control group indicated they did not need stress management and were too busy anyway. Now, during the time when the study was done, I cannot say what was happening, socially, politically, or whatever else in the Miami area. But what we do see is that whatever was going on, or maybe versus crime or whatever, but we can see that the controls, their heart rate over 10 weeks was increasing greater and greater. So something was going on socioeconomically, within the Miami area that was affecting the controls. When you look at the experimental group, their heart rates were going down. And when you look at the difference between the two, there's almost a 30 heartbeat per minute difference between these two groups, between pre and post measures, which is highly significant. Because if you were factoring in for environmental conditions, even if this group, the treatment group, went down, because the controls went up so much, we would probably see more of a flat line if they went down just to 15 points or so. But relatively, yes, it was a dramatic change. So we're looking at the drop plus compensating for whatever stressors were going on in society at that time. Now, on the David session editor, which we use to program all of our devices, we do have a heartbeat that is a pacer on all of our sessions. We know that, and that's designated by the red line right here. Now, we know that most people, of course, when they're just going to run a session, they've been walking around, moving about. Maybe they've got some distressing thoughts in their heads. They're anxious some. So their heart rate will be driven up a bit. So we give them 28 beats per minute of the heart. There's actually a heartbeat sound that plays. And we play it at 28 beats per minute. And if you have a 4 heartbeat, or in this case, a 4Q, because the heartbeat is used as the cue, you have a 4-beat breath cycle, and there's 28 beats per minute. That would mean you'd have 7 breaths per minute. At about 5 or 10 minutes into the session, however, we do slow that heartbeat down to 24. And based on 2 breaths or 2 beats in breath and 2 beats out breath, we would get 6 breaths per minute. It's not advisable to start someone at 6 breaths per minute because the breathing would be too slow. And a person then can have some anxiety or even a little panic from not getting enough oxygen. So that's why we do it this way. In reality, I prefer to have 1/3 of your breath being in breath and 2/3 of your breath being the out breath. But that's complicated, and a lot of people with anxiety can't wrap their heads around it. They can't handle it, and it makes them more anxious. So just simple, 2 beats in, 2 beats out. Now, here's a lady here, and this is a pretty good example of what good heart rate variability looks like. And this was during Schumann entrainment. And we can see here quite a stable heart rate rhythm across the board. Now, when you see these variations like this in trending, that variation is a low frequency, and it represents sympathetic activation or sympathetic changes. If you see fast little glitches like maybe we see right in here a bit, that's high frequency, and it represents parasympathetic changes. So in this case, this lady was doing very, very well during entrainment, had a good score. Heart rate was 73 beats per minute, and her coherence ratio, they used to call it entrainment ratio in the old days, but it's called a coherence ratio now. And this is using the M-Wave PC. And you can see that her ratio is very high. And when you do spectral analysis, of course, we're trying to do a 10-second breathing cycle, and 10 seconds equates to 0.1 hertz. So you should see a witch's hat in the spectral display. No parasympathetic activity on the faster frequencies and no sympathetic activity in the lower frequencies, or very little. As you saw, there was a little trending that she had, which is showing right up here as a little bit of low frequency infiltration of her spectral array. Now, this is a 37-year-old female who was in a great deal of despair and anxiety at the time we met her. And this woman's life was turned upside down when the police showed up at her door and charged her husband with molesting 2 young neighborhood girls, ages 6 and 8. He also had a great deal of child pornography on the computer. She moved to the city and filed for divorce. The husband, however, is aggressive. He blamed her for his problems, saying she wasn't good enough in bed. He contends he has done nothing wrong, citing the girls seemed okay with it. Some scary excuses here. And he's an electrician, and as an electrician, he was paid quite well at his job, and so he had the money to be able to hire a lawyer who awarded him alternate weekends of her young son and daughter, who were 6 and 8 years of age. And that distressed her greatly. And you can see why, of course. Now, when people are very stressed, they mimic the pattern that a stressed animal cornered in a cage would exhibit. And I call it spike and clamp, or clamp and spike activity is probably the better way of saying it. What we're seeing is that the heart rate variability is very clamped, but there's very little swing at all. And then there's a big spike. And then it's clamped again. Then you might see another spike. And every few minutes, you'll see a big spike. I don't know why that occurs, but it does occur. And I see it frequently enough. In this case, she has no score to speak of at all. Now, I've taken the inset of the spectral display and just dropped it in onto these graphs so I don't have to show you so many slides to make the point. And we can see her, she's trying to breathe here at 0.1 hertz. But sympathetic and parasympathetic arousal is all over the board. And when sympathetic goes up, parasympathetic goes up with it to try to stabilize the sympathetic arousal and the cortisol that's being released in the body from the adrenals. So we put her on entrainment. Now, when I do this type of research, what I do is I put the headphones on, and I put the Eyesets on, but I turn off the tones. So the bump, 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 bump and training tones are turned off, and I also turn off the lights in the Eyeset. But they're still receiving the heartbeat. So I teach them to breathe to the heartbeat and then see how they naturally respond to being breath-paced. And as we can see, not so good in the first panel here. But now, about 5 minutes into entrainment, I start recording, and we can see she's dissociated now and is giving us a beautiful heart rate variability response. And that's very, very nice. Nice swing, 15 to 20 beats per minute, roughly, maybe 10 to 15 more so in her case. She came out of her dissociation for about a minute and started having all kinds of thoughts about her situation and her dilemma that she's in. Right in here, that's where she lost her variability. And in the score, we can see the score was also eroded right here. Then she drifted off again and quit thinking and let her body do what it's naturally good at, which is breathing and regulating its heart, when we're not influencing it with autonomic stuff, or in this case, stuff from the cortex, thinking and things. Now, when you use entrainment to do heart rate variability, often the results are so profound and so fast that they feel it so strongly that they identify with it very quickly. So we did, in this case, we did happy thoughts, negative thoughts. I always do happy thoughts and negative thoughts. It's an amazing diagnostic to do it that way and see what's going on and see what their perspectives are on their lives and so on. And I'll show you some more examples of that in a bit here. And we can see here, happy thoughts, heart rate is slower. Negative thoughts, of course, it's driving up that heart rate because of stress caused from the negative thoughts. Entrainment, which we were just showing you there, slows her back down, but she caught onto it so fast that she was able to do breathing on her own within the same session, and she slowed even more when she was self-paced. And so that's very good. This is a 28-year-old female, and this young woman came to our office just to see what we did, products we made and so on. She was just thinking about enhancing her life, and she indicated she was already doing very well in her life and had no issues per se to talk about. However, one of the things we have found in people with baggage and issues that are unresolved is that they have to keep busy to keep those intrusive thoughts out of their mind. And when you make them sit quiet, at about 3 minutes, they start to come to pieces. And that's exactly what happened with this lady here. Natural entrainment, all on her own, just pacing to the heartbeat. And then she starts to fall apart as these intrusive thoughts start getting into her mind and cranking up her autonomic nervous system. And we can see this represented by her score beginning to erode down here. At the end, believe it or not, at the 8-minute mark, she was crying and quite distressed and distraught as a result of all this baggage that was creeping into her mind. So we can see here, her anxiety began to show, and by the end of the session, she was crying, feeling guilty about all the drugs she did when younger, that her husband considers her high maintenance, and she was wishing that she had a better job and could get her act together. And there was a fair bit of marital conflict at this time as well. And of course, that was playing out as well. She did not want to be a single person. So we can see here that she's trying to breathe in this range here, but she's all over the board with sympathetic and parasympathetic arousal. Heartbeat is 77. Her coherence ratios are rather poor. Put her on entrainment, give her 5 minutes to dissociate into a meditative kind of trance. and then just pounds out a beautiful, beautiful result right here. Great score, a meditator's peak, which I say looks kind of like a witch's hat. And that's where she should be breathing at 0.1 hertz, and she's very close to it. And a very, very good coherence ratio right in here. Now, this young girl, unfortunately, I mean, she was a shy, naturally shy young girl, and a really beautiful, wonderful lady. But in grade 3, she had this grumpy old lady teacher who took out her rage, aggression, and hostility on this poor girl and would make her stand in front of the classroom and do math questions. The girl, of course, being shy and all and scared, would freeze up. And then the whole class would laugh at her. I don't know. Nobody knows to this day why this teacher was so mean to this girl. But as a result, she's always considered herself stupid. She always wanted to be a vet, but she can't do math, so she never even tried because she was too stupid to be a vet in her mind. And you have to be able to do math when you're administering meds and stuff like this. At this time, she was a receptionist at a local business and figured that was probably the best she was ever going to achieve because she was so stupid. So we worked on getting her breathing in fairly good order. Of course, the diagnostic showed a lot of things. I'm going to tell you what the diagnostic showed in this case. So we're running just the breath pacer here and the left panel, and she's breathing to that. It's not great, but it's not so bad. Here she's breathing here. You can see that she's actually breathing faster than what the pacer was set to. So at times she was cheating some and breathing ahead of the beats that were being used to pace her. Some sympathetic, some parasympathetic activity. And we see her score down here, not so good. Heart rate is 91 beats per minute. When I turn on the bump, bump, bump sounds, the entraining sounds, and the lights, in her mind, she's thinking, oh, this is the treatment, so I better do better. And then the process of that performance anxiety and that fear of failing, she gets worse. And we can see here, her scores dramatically eroded. And we can also see up here that you can just see it in heart rate variability, erraticness of that, of the raw data here. Sympathetic, parasympathetic activity, a whole lot higher. She's still trying to breathe here. And her heart rate sped up. So realizing that she cannot perform in front of me because of her performance anxiety, it just made sense that I would just send her home with the device and just have her do her breathing on the device, in her own home, and where she doesn't have to perform in front of anyone else. So she did that for a week. Now, normally speaking, whenever I have someone do heart rate variability with a session that's running, I only advocate that you do it 5 or 10 minutes. You don't want to fight the dissociative aspect of that session all the way through a 20 or 30-minute session. You just breathe as an assist so the session can take you down into a deep trance. And as you get drifty and you're starting to drift off, then just let the breathing go and just breathe naturally. Don't try to fight it and let the session take you away and have the healing aspects of what the sessions do well. So I did that for a week, and she came in the following week after practicing every day. This was her result. It was utterly beautiful. And she did so well with this. You can just see it. I mean, look at the difference. It's excellent. A very, very good result. Now, once we had her breathing well, then I was able to work with her on her math. And one of the things I have to do with people, of course, who have a bad self-image is we have to really boost that self-image. And there's a variety of things I do. One of the things is we make lists of good attributes that they have. So good things about themselves. And that helps them reframe their own opinion of themselves. And that helps to some degree as well. But in this case, what we also did is I was giving her math questions and getting her to subtract sevens. And I remember the first one was, what is 650 subtract 7? And she goes, I don't know, I have no idea. I don't know what the answer is. I said, give me any answer you like. She goes, 128. That's incorrect, but you're still a wonderful person. Because you can't do math doesn't mean you can't be wonderful. So I explained this to her. I give her another question. What's 270 take away 7? I don't know. I don't know. I can't do it. I don't know. Any answer you like. 67. That's incorrect, but you're still a wonderful person. And I kept reinforcing that with her. We did 20 math questions. She got all 20 wrong. She took entrainment home and used it for the following week. Came back again. Of course, I've been implanting seeds now that she's a much more wonderful person than she comes to realize. I also had her collect words from her coworkers and friends and things like this, and family, good things that they saw in her. And she was amazed at all the good things people saw in her that she never realized she had. So we're reframing her opinion of herself, so she's not self-critical. It's very hard to survive being self-critical because the voice is inside your head and it's very, very present. So it's good to work on that. So anyway, the next week she came in, again, started the math questions, and she'd been using entrainment all week. The first about 10 sessions she got wrong. And I just kept saying, well, you know, it's incorrect, but you're a wonderful person. Now, I use this alongside the Wild Divine biofeedback software, and they had some beautiful screens, you know, that showed you your electrodermal and your heart rate activity on these screens. And one of the screens they had a balloon that would slowly go across the screen. And when your electrodermal increased, the balloon would go up. And if it increased a lot, the balloon would pop. And if your electrodermal went down, you know, indicating relaxation, the balloon would drop down on the screen as well. And then it would recycle itself every 10 seconds or so, or 20 seconds. And of course, the first round, she popped her balloon on pretty much every math question I gave her because she was so tensed and stressed about it. On the second round, that balloon was going up some, yes, but it wasn't popping. And she did get the first 10 questions incorrect, but the second 10 she got correct. And she was suddenly like, whoa, I can do math. The third week she came in, she got every single question correct. And then we thought we would up the game. And I started saying, well, you know, what's 647 take away 23? And we started making the questions more complex. We did some multiplication, we did some division, and she could do math very well, this girl. She had no trouble with math at all. So I really drilled in that, no, you are a bright person. You are very capable. You just can't function under fear. It's the fear that's shutting you down. It's nothing else, just the fear. And it really sat home with her, and she really got that message. And it changed her life dramatically. I don't know if she went on to be a vet or not, but I know that after, this was only about a 5-week process, and she completely changed from a very distressed, upset, self-critical person to a person who was pretty happy and bouncy, and it changed, even her face changed the way she looked, you know. So it was a wonderful case. Again, I always do negative thoughts and happy thoughts. And this is a girl here who had, oh man, her and her sister had just a terrible life. Their mother, probably a full-blown psychopath, was brutal to them when they were growing up. And they sure had the trauma from it. So I do negative thoughts and I do happy thoughts. Her older sister, about 2 years older, had moved out of home about a year before and was living with her boyfriend in a little townhouse that they were renting. Her mother somehow tracked them down and found out where she was living, then went to the local pub and paid a guy $100 to come over to the townhouse and tell her boyfriend that he was having an affair with her because her mom was trying to break them up. So she would have, I guess, power and control or vengeance. I'm not sure what it was. Her mother also would do other, just sickening things in some regards. In public washrooms, if there was a light switch on the wall and there was someone going to the bathroom, when her mother left, she would turn off the lights just to be mean to the person who was in the bathroom, who now had to do their business in the dark. Her mother did things like this. Now, meanwhile, with this girl here, She had also moved out of home, and she was living with her boyfriend in a second-story walk-up apartment. And again, mom managed to track her down somehow and find her. And at 2 o'clock in the morning, mom is throwing rocks at her window and waking her up, and then yelling at her and asking her why she's such a B word and unappreciative and got this bad attitude towards her. Just reaming her out at 2 o'clock in the morning from the parking lot. Say her mother was not psychologically well. That's absolutely the case. Now, this girl's hand temperature too, when she would get distressed when we were doing things, it would climb very, very hot, and that would trigger a headache in her, a vascular headache. And most of the time, people will vasoconstrict when they get stressed because that's the natural flight or fight response. But you can be conditioned to have vasodilatation when you get distressed. And this is how it worked in this case. Her mother, who was also abused by her mother, lived in a very cold house back in those days when there were poor furnaces and poor insulation, and the house was often cold. So the mom was always vasoconstricted all the time and had cold hands and a cold body, cold feet. So she kept the house turned up, to 80 degrees Fahrenheit all the time, which, 24, 25 degrees, 25 degrees Celsius. And so this girl and her sister were raised in a very hot house, and they were always hot and always very vasodilated because of the heat. So when they experienced their traumas and their anxieties, they were conditioned, they were paired to have that anxiety while they were heavily vasodilated. And as a result, they vasodilate, which triggers a vascular headache from overdilatation whenever they get stressed. I see this occasionally in my clients, not very often, but it does show up occasionally. And typically it's because they were in a very hot home and made those conditioned responses under stress. Now, take a look at her negative thoughts and her happy thoughts. Negative thoughts, not too bad. Pretty good score. Heart rate 82. Not a bad coherence ratio. Not too bad. That's her breathing peak here. Some sympathetic activity, very little parasympathetic in this case, despite herself supposedly having hot hands. So it goes to show you can be conditioned to vasodilate without it necessarily being parasympathetic. Happy thoughts were worse. At this point in her life, she really believed her life was terrible and it was going to go to nothing. She was going to end up breaking up with her boyfriend and just be, living alone and be lonely. So you can see that when we did happy thoughts, her heart rate actually went up, her sympathetic activity increased, and her HRV got worse. This is why you use HRV as a diagnostic. It's awesome. And you can just see so much stuff. And if you pair it with electrodermal, you're doing even better, which I'd highly recommend. So she cannot manage happy thoughts. Her life is a mess, and it's going to stay that way in her mind. So let's take a look at this. So again, like I mentioned before with this other girl, I have them make a list of 50 good things about themselves. And I usually start with 4 or 5 because they can't come up with one. And then after I give them 4 or 5 things that I think are good attributes about themselves, then I can usually get them to throw in a few. Then they have to go see their allies and just tell them that they're doing therapy and this is part of the therapy and they have to get supportive comments. And they go to family, friends, and coworkers that are, again, supportive of them. And they start saying, well, you're this and you're that and you're that. And they're like, really? I never knew that. Really? And it just blows them away that all these people in their lives see them to be a much, much better person than they see themselves. And they get a list like this that they're caring, they're supportive, they're loving, they're sacrificing, they're giving, they're passionate, they're nurturing, self-aware, loyal, honest, fun, impeccable. These are the types of things that people will tell them. And then they write it all down. They come in the following week, they sit down with me, they start reading off this list. And it isn't long that they're crying their eyes out because they're just so, that emotion is just coming out of them. They're just so relieved to know they're a much better person than they thought. Usually I'm crying with them because it's very moving to watch this transition occur. And you just can't really get through it without crying. And so I'm crying with him. So she did that exercise. They have to type it up, they have to frame it, hang it on their wall. She did all that, came back the following week. Now look at her heart rate variability. No biofeedback, no entrainment even, nothing at all. We just had to change her perception of herself and get those negative thoughts that were distressing her out of her mind. So I sat her down a week later and said, do you want to do happy thoughts and negative thoughts? Because in this case, she was a mess regardless of whether we did happy or negative. And she goes, you know what? I'm prepared to move on in my life. I can actually see my life going well. And I'm just looking forward. So I'm just going to give you happy thoughts from this moment forward. And so these are her thoughts, her happy thoughts. And she would not do the negative ones. And she said that she could see her life proceeding in the beautiful and wonderful ways and deserving all the goodness that life has to offer her. So wonderful. And again, we use HRV as a diagnostic tool, and there was no other intervention at all, except for the fact that we had her change her, her perception of herself. That was it. One of the things I always do is I also, for transference out of my office, is I teach my clients a little mantra that they can practice. Now we have to practice this in the office with the heartbeat pacing because they have to learn how to say it. The mantra is a little bit wordy because when people get anxious, they get racy-headed and they get fast. So the wordy mantra slows them down. And they think of something soft and cuddly. Usually it's a puppy dog or a putty cat. We've had some interesting choices that people have picked, including Santa's elves. One lady completely relaxed to hockey players. She loved watching hockey, and that was her nice zone to be in, her relaxation zone when she watched hockey. So most of the time it's going to be putty cats or puppy dogs. And so we train to the heartbeat so they understand how the pacing works. And after they get kind of good at it, which doesn't take too long, 10, 15 minutes, then I turn the heartbeat down and I see if they can maintain their pace and without getting faster or slower too much, and stay fairly on track with it. So literally in this case, we would say in putty cat, 2 putty cat, 3 putty cat, 4. Of course, in for the in breath. And then out putty cat, 2 putty cat, 3 putty cat, 4. So if they're driving in traffic and something happens that upsets them, or they're at work or they're at home and something upsets them, start going through this mantra in their head and do the breathing in and out in accordance to it. And it has been quite effective overall. Now here's a very interesting study on hypertension. Of course, all these people that we typically treat with heart rate variability, we use alpha. And alpha typically works exceptionally well for calming them down, right around 10 hertz or so, maybe Schumann resonance, but in that range, alpha, alpha theta, or thalpha. Now, however, I did a study with an internship student from the University of Alberta here in psychology, and we wanted to see how entrainment affected hypertension. And now, when you look at this graph, this is from the American Heart Association, and what they're showing here is that if you make lifestyle changes, you can generally bring down systolic about 5 points and diastolic about 2 points. If you get on some meds, you can bring it down about 10 and 8. With multiple meds, you can bring down systolic about 17, 18 points and about 12 points on diastolic. And here's subdelta AVE bringing down systolic 20 points pretty much, and diastolic about 14, 15 points. Now, subdelta group was our sham. And so why the heck would a sham be extremely effective? Alpha AVE, not so effective. Well, a little mistake happened when the study was done. I wanted to, of course, look at people with depression and anxiety. So they were filling out the Beck Depression Index. They were doing the STAI ANX. My student heard, get everyone without depression or anxiety. So everyone who was non-depressed and non-anxious was included in the study. So what this means that everyone we looked at with hypertension did not have their hypertension from cortical inputs. When you have stress and anxiety and depression and all that, well, you've got cortical inputs that are playing out by overriding the autonomic nervous system. But what is going on, do you think, when there are no autonomic inputs and you're still having a heart condition? Well, it turns out, as I think I've probably mentioned before, and we've seen this in a fibromyalgia study, and clinically, we see some pretty good results from time to time using subdelta in the 1 hertz range. Now, there is a rhythm that the hypothalamus has, which is right in the subdelta band at around 1 hertz. Since we've done these studies on fibromyalgia and hypertension and had some clinical observations, we now use sham in the 0.1 to 0.5 hertz range, so we don't affect the hypothalamus. But anyway, so this is the issue, is that when they were given subdelta, we had a dramatic effect. These people in this study had hypothalamic issues, not cortical issues, playing out on their hypertension. And subdelta was remarkably effective at bringing that blood pressure down. And alpha AVE was not so effective, and that would make sense. Alpha AVE is not going to be that effective on a hypothalamic issue, and vice versa. Subdelta AVE is not going to be very effective on a cortical issue. So these are things to observe, I guess, when you're looking at your clients who have hypertension. Now we're going to talk about the Spectrum Eyeset and the Breathe app. If you go to the Windows Store and you type in David Breathe, you will find a free Breathe app, and this is what it looks like. And you can set up inspiration, a hold, and expiration, and you can have this just sitting on your desktop while you're working on your computer. And it can remind you when to breathe in and when to breathe out and help keep you calm and relaxed and in the zone while you're doing your daily work on your computer. The app itself just runs all by itself without anything else, and it's free, and it's a great little app, and I would highly recommend you get it. Now, this is from John Lemay. Fortunately, clinicians are submitting some of their results to us, so it's not coming from me. This is real good data coming from other clinicians who are finding it effective. And this is from John Lemay. This is from a lady who failed at HRV biofeedback, and so was referred from a clinician to John because John figured he could tackle her and get her better, and the other clinician had given up on her. And we can see here that prior to entrainment, look at her finger blood volume. I mean, she's got cold fingers. She's all vasoconstricted, highly sympathetic. When you look at the respiration band that's measuring her respiration, which is the blue in the lower set of graphs here, that's the blue tracing. We can see that although she's trying to breathe with the pacer, she's not doing too bad, but her heart rate is all over the page. It's not synchronized to her respiration. Turn on the entrainment at this point, and just in a couple of minutes, as she dissociates out of her autonomic overactivation, hands suddenly start to warm up as she vasodilates, and you can see that her heart rate quite quickly starts nesting into her respiration. And it doesn't take long, just minutes, and she's starting to nest into her respiration very well and have a profound relaxation response as a result. This year was a lady who actually was attending my lecture at the AAPB conference. She's been practicing yoga breathing for decades and is also a teacher. So when I was presenting, of course, and I have the Eyesets plugged into one USB port, and typically I will plug in this case, the M-Wave PC into the other port, and so I can monitor her heart rate variability simultaneously while she's on entrainment and getting breath paced through the David Breathe app. And we can see here, without biofeedback, she actually, all these years, she's been practicing without biofeedback, and her breathing is not so good. You can see that down here in the score. We can see it up here in the raw. We turned on entrainment right here and the breath pacer, of course, by changing colors. So instead of being rigid, like a metronome or a drummer, it's giving you suggestions in a sense to breathe in and to breathe out, which people find a lot more palatable and a lot easier to get along with when it's a color change rather than a hard pacer. And you can see very quickly, we turn this on and almost immediately, she starts giving us very beautiful HRV rhythms. And we can see that right here in her beautiful score that is happening. So, and this is a person who thought she was, an expert at breathing. This is another person here who has had multiple concussions. She also had very good response. This is from John Lemay again. John has been a real advocate for us, which I appreciate immensely. And we can see here when the entrainment is turned on, we do get a better settling effect. And you can also see, these are separated, but you can actually see there's a nesting effect starting to go on with the heart rate and the respiration down there. If you were to superimpose them, you'd see them lining up. This is a lady with a brainstem injury, which gets kind of critical because heart rate variability and heart function is regulated through the brainstem, as we saw earlier. We can see her, she's trying to breathe here, and you can see that her breathing is not bad. Vasoconstricted, heart is a mess. It's all over the board. Put on the entrainment, very quickly vasodilates as the sympathetic nervous system shuts down, and you can see that her HRV starts to get fairly smooth and rhythmic, certainly way better than prior to AVE. And it's fast. A couple of minutes is all it takes. Here's another example of a person with a headache, chronic migraines. And we can see here too, this is now with AVE running. She's already been running on AVE for several minutes. And we can see just how nicely her heart rate is nesting into her respiration. So my recommendations for heart rate variability, I think heart rate variability has unfortunately taken away our natural therapeutic instincts to use heart rate as a diagnostic tool. Don't do HRV biofeedback at the start at all, never do. Use the HRV as a guide to see what's going on in that person's life and where their conflicts are, where their baggage is. That's where HRV really shines, right? So that's what I recommend. And as you see their HRV change, as we saw in these other cases that I've just presented, when you start getting them, in the zone from a mental health perspective, their HRV typically will resolve itself. They don't need biofeedback. If you teach them just to do HRV biofeedback and yet the issues are still residing, I mean, it's just going to fail, generally speaking, and then they'll quit coming to see you and they'll still have all this baggage and issues and one more failure under the belt, which people with mental health issues just don't need. Use entrainment only without HRV, or you can use it with HRV, maybe the second or third session. You'll have to assess your patient. If your patient seems amenable to AVE with HRV right at the onset, then by all means do so. If they seem to be so wired up and anxious that maybe they can't even handle the HRV pacing with entrainment, then just give them an entrainment session, knock them right out, get them relaxed, and then do HRV on the second session. But use AVE anyway at the onset to quickly restabilize their autonomic nervous system, shut down the HPA axis, get them restabilized, get them into homeostasis, and settle them down very nicely, which will start to make them amenable for therapy and so on. Of course, you wouldn't want to do necessarily HRV diagnostics after they've done entrainment because their heart rate variability would be very smooth and very nice following entrainment. So when they come into the office, if you're still using HRV as a diagnostic tool to see what's going on in their lives, then do that first and then put them on entrainment. And as I mentioned before, entrainment lends itself extremely effectively as a triage type of treatment, and it works exceptionally well. And it's a good starting point, which will get them calm and settled. It'll get them on board because they'll feel the difference, and then you can do other therapies at that point in time. Thank you very much for attending this lecture. I'm going to give you a short demo of what the Spectrum Eyesets being controlled from the Breathe app is going to look like. So we're not quite done. Bear with me for another 5 minutes or so. Thank you. This is the David Breathe app, which you can download from the Microsoft Store for Windows 10. It only works on Windows 10. Now, this is what it's looking like here. And you can see in this case, I have a heart that's growing and shrinking. So we inhale when the heart gets large, and we exhale when the heart is getting smaller. Now, through File Manager, you can grab any picture you want and just drag it and drop it into this, and you'll also then have a picture image, and the heart will become a thin outline, as I showed you earlier. You can also select other types of graphics for this. Here's a star, and we have a happy face. Well, the heart is my favorite one. And there's also a cloud. Cloud's kind of nice. Anyway, back to the heart. You can do settings here. And we can see here with the settings, you set your inhale. You have a hold if you wish. You have an exhale and an exhale hold. If this is checked off, every time you power up your computer, it'll automatically run and remind you of how to breathe throughout the day as you're working on your computer activities. Now, there's also a section here, which is the Spectrum Eyeset. And you can set the session type, everything from sub-delta up to gamma. I typically will use healthy alpha, or I'll use the depression protocol, the mood booster. You can also select your colors, and you see we've got this reddish colors for inhale and blue-green for exhale. Reddish colors are more sympathetic driving, and exhale colors are more parasympathetic driving. Take us back now. And so as you can see here, it is just pacing us to remind us how to breathe while we're working on our computer. But if we plug in, it's going to detect the Eyeset, and in about 3 or 4 seconds, it will start to entrain the Eyesets. And you'll see why this works so well and why it is so effortless. It's going to start counting down. Now, you can set that timer to anything you want. I have it preset to 10 minutes. You can set it to 20 or 30 or 40 if you wish. Now, we've got entraining tones are starting to come through. You can hear them in the speaker. So you would use headphones to play this properly. We also have these randomized mildly, because randomizing is more dissociating and has a more profound calming effect. So these are randomized, and by up to ±1 hertz. So that's how the Eyesets work. And you can see on the screen, it's counting down. So it's all automatic, and it's a great way to work with your clients while you can perhaps be working with other clients. So once we plug in the Spectrum Eyesets, it takes a few seconds for the Breathe app to detect the Eyeset and fire it up. So you can see here that it's providing the green and blue for expiration, and then it switches to magenta for inspiration. You also see that it gets dimmer on expiration as you get towards the end of your breath, and it gets brighter and brighter on the inhalation side as well. You can use the plus and minus buttons right here to make the Eyesets brighter or dimmer. You'll also hear pulsing tones on the computer. Right now they're very quiet, so you might not quite hear them. There's a bit of a bup, 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 bup sound. You would be wearing headphones at that time, or your client would be wearing headphones. They would be in training to the auditory at the same time as the lights. So that's how the system works. Okay, now you will do this with eyes closed. And so remember that. So you may have to bring up the intensity some. And for people with darker skin, you may need to bring up the intensity a little bit more. But the colors pass through the eyelids quite well. And eyes closed is really the best way of doing entrainment. I would like to thank all of you for attending my webinar. I hope it was elucidating and inspiring, and will help you, do better at your practice and helping people with mental health issues get better and function better and have fuller and better lives. Thank you very much. If you have any questions about this lecture, please contact us at Mind Alive. Send your email to info@mindalive.com. Thanks again. I wish you all well. Stay healthy.